This week is World Breastfeeding Week, a week promoting a woman's right to breastfeed in public. And research shows that breastfeeding has several benefits for both mom and baby. And here with more this morning from St. Mary's is manager of Family Care Suites, Beth Rozak, and lactation consultant, Lisa Hartson. Good morning to you both.
Good morning.
All right, so let's start with whoever wants to tackle this question about why breastfeeding is important, about the benefits for both mom and baby.
Well, World Breastfeeding Week intent is to raise awareness on the importance of breastfeeding. The American Academy of Pediatrics does state that breast milk is the ideal nutrition for babies. For the benefits for a baby, it does increase or decrease the risk of getting allergies later in life or asthma. Can also reduce the risk of getting ear infections. Benefits for mom can be to get mom back to the normal weight pre-pregnancy.
That's true.
In addition to decreasing ovarian breast cancer as well.
All very good things, good bullet points. Now, Lisa, breastfeeding isn't always as easy as it looks.
Exactly.
So this is when you, thank goodness for lactation specialists. So talk about the challenges that new moms have and how you can help overcome that.
Right. So I always tell moms, usually the first 2 weeks is usually the hardest time. Just sometimes they have problems with sleepy babies initially, kind of waking them up, you know, just I always encourage lots of skin to skin, just keeping that baby close, picking up on those subtle feeding cues, just to let mom know that baby's ready to eat. Sometimes, you know, we have some, you know, initial soreness or difficulties latching, and, you know, those are all things that are usually temporary and easy to overcome.
You know, and after you leave the hospital, you know, we would like to take you home with us, but we can't. So what are the support services available to moms out there when they do get home and still have some problems or questions?
Definitely. So St. Mary's Hospital, we have our warm line that we have a magnet, and we give everyone our number, so they can certainly give us a call and let us, you know, we'll walk them through any questions that they may have. We've also recently started a new support group here at the hospital for breastfeeding moms. It meets every Thursdays from 1:30 to 3. And it's just located just right off of the cafeteria downstairs in the hospital there.
Easy access.
Exactly.
All right, so let's talk about the transition back to work, because some women, they can take 3 months off, maybe not so much, and there's a lot of women who, you know, they can breastfeed as long as they want to. How can work make it easy for them, the transition and stuff, because you still got to be doing something every so often. So what advice would you have?
Well, luckily the Affordable Care Act does make it a requirement for employment to facilitate the proper time and place for privacy for moms to pump while they're at work when they do go back.
And there's a lot of women that do that.
Yes.
Okay. And talk about the laws that we're dealing with.
Okay. So with the Affordable Care Act, Wisconsin has state laws that prohibit any discrimination against any woman breastfeeding in public. So if you are out in public with your baby and your baby needs to nurse, you have a right to nurse and breastfeed your baby, covered or uncovered. And no one, it's illegal for anyone to discriminate against you or even ask you to move to a different location.
This is your field. We've had a few stories lately in the news that have gone against what we know. This has got to be frustrating.
Yes, yeah. I do a lot of classes for St. Mary's, and I teach the breastfeeding class occasionally, and one of the things that I always tell moms is I feel like moms need to be out there and we need to be breastfeeding more often in public, and it needs to be more of a normal thing. People need to see that, and they need to see that it is normal.
Yeah, it is not taboo.
Exactly. Yeah.
All right, ladies, thank you very much. Appreciate it.
Thanks for having us.